Hey there. My name is Pharmacist Michael, and welcome to our channel. Today, we're diving into the world of medications, and we've got a super interesting one for you: Nortriptyline. Now, I know, medication talk can get a little dry, but stick around because we're going to make it fun, easy to understand, and maybe even just a little bit entertaining. So let's jump right in. Nortriptyline is a medication that falls under the class of tricyclic antidepressants. It's been around for quite a while and has a range of uses that just might surprise you. But before we get into that, let's talk about what the FDA has given the green light for. First up, nortriptyline is FDA approved primarily for treating depression. Yep, it's designed to help balance certain chemicals in the brain, which can make a huge difference for people dealing with major depressive disorder. To be honest, we don't really use nortriptyline for depression in new patients much anymore because we have safer alternatives. But guess what? Doctors sometimes prescribe nortriptyline for other purposes that aren't specifically FDA approved. These are known as off-label uses, and let me tell you, there are quite a few. One of the coolest things about nortriptyline is its versatility. Besides treating depression, it's often used for things like chronic pain, especially nerve pain and migraines. It can also be helpful for treating anxiety, insomnia, and even some cases of ADHD. And get this, it's sometimes used to help people quit smoking. Who knew, right? But that's not all. Nortriptyline is also used off label for some pretty specific conditions, like the prevention and treatment of cyclic vomiting syndrome, which is a rare disorder that causes recurring episodes of severe nausea and vomiting. It's also been found effective in treating irritable bowel syndrome, or IBS, by helping to manage pain and discomfort. And if you've ever heard of postherpetic neuralgia, a painful condition that can occur after a shingles outbreak, nortriptyline can be a real lifesaver there, too. Now let's talk side effects. Like any medication, nortriptyline comes with a list of potential side effects. Some of the more common ones include dry mouth, drowsiness, dizziness, and constipation. But there are also some less common ones like blurred vision, weight gain, and trouble urinating. And while these side effects might sound a bit scary, it's important to remember that not everyone experiences them. And for most people, they're manageable. But if you experience anything severe like chest pain, severe mood swings, or signs of an allergic reaction, you really should contact your doctor right away. So, who should steer clear of nortriptyline? Well, it's definitely not suitable for everyone. If you've recently had a heart attack, or if you have a history of heart disease, nortriptyline might not be the best choice. It's also not recommended for people with severe liver disease or glaucoma. And if you're allergic to any of its components, that's a big no-go. Speaking of things to watch out for, let's talk drug interactions. Nortriptyline can interact with a variety of other medications, which could lead to some unwanted effects. For example, it can increase the risk of serotonin syndrome when taken with certain antidepressants like SSRIs or SNRIs. It can also interact with blood thinners, medications for high blood pressure, and even some over the counter cold medicines. So, it's super important to let your doctor know about all the meds you're taking. Now, let's talk about some special considerations. If you're pregnant, planning to become pregnant, or breastfeeding, you'll need to have a conversation with your doctor about whether nortriptyline is right for you. It's also important to avoid alcohol while taking this medication, as it can increase drowsiness and dizziness. And here's a pro tip: nortriptyline is usually taken at bedtime. because it can make you a bit sleepy. So, if you're a night owl or someone who's constantly on the go, taking it at night might help you avoid that midday slump. Please remember that this video is for informational purposes only, so always consult your healthcare provider for advice tailored to your situation. If you found this video helpful, give it a thumbs up and don't forget to hit that subscribe button for more health tips and tricks. I always welcome comments and questions, and let us know if there's a specific medication you would like us to cover in the future. Thank you so much for watching. My name is Pharmacist Michael. Be happy and be healthy.